Productive Dentist Academy podcast network.
What's your gum scores? How many bleeding points you have? Because how do you know if you're healthy? It doesn't, it doesn't hurt.
Yeah.
Nothing's, your teeth aren't mobile yet. You can mask your bad breath, and you might see some blood when you floss, especially, or brush, but you're like, it's not doing that all the time, right? So here's how we did it. We created a gum score with a number, and the number is the number of bleeding points.
Listeners, doctors, hygienists, assistants, what would happen? Close your eyes with me for a quick second here. Imagine what it would be like if your patients could easily understand their periodontal health just as easily as you understand your blood pressure or your cholesterol score. That would personally blow my mind. I've been in dentistry for a decade and a half, and I am still learning new things every day. And one of my favorite things about our upcoming guest is how much I love to bring you really high quality people that are passionate about solving a problem. And on Everyday Practices today, we have Dr. Tanya Dunlap. She is the Vice President of PerioProtect, which I think you've been at since 2005.
Yeah, 20 years now.
20 years now. So you're well in the passion category. You know what you're talking about. And I cannot wait to jump in and really discuss the benefits of the health benefits of it, but also, the overall well-being benefits of what it means to be able to connect with our patients and communicate in a way that does that. I understand that this is important and that there is a solution to it.
That's right.
So could you tell us a little bit about your background and why periodontal health?
Well, this was not an anticipated career path. And it's a long story, but I will say one of the things that really made it possible for me to understand better the everyday, I'm not a dentist, right? I'm a PhD. So just that everyday clinical experience was working on controlled clinical trials, testing PerioProtect as an adjunct to scaling versus scaling alone, and really kind of getting into the nitty gritty of clinical trial design. I was the research liaison for the company. There was independent contractors for studies and independent statisticians, and we had a periodontist on the team also for consults. It was a really good time and fun to kind of be part of this team and to see what they were doing. So that's where I got my chops. And that's how I really became the go-to person to understand what PerioProtect is. And if you are listening and you don't know what PerioProtect is, it's an adjunct home care. It's a tray that is cleared by the Food and Drug Administration to deliver medication really deep below the gum line. And when we say really deep, we mean up to 9 millimeters. So it is great for patients who've got, shallow pockets and gingivitis and chronic inflammation. And it is excellent for patients who need really complex treatment plans and you want to maintain them better at home between office visits. That's what we're about. Reducing the infection, the inflammation, even reducing pocket depths between office visits. And you just use this tray. It's custom made. It's got an internal peripheral seal so that your medication doesn't leak out. And you just wear it 10 to 15 minutes at a time. And the primary antimicrobial is kind of a fun story. Do you want to hear it?
I do want to hear it.
Okay. So I know all about this because my father was the person who created this medical device. And so I was in the background as he was working on this for longer than the company was around.
And your father is a dentist, is that?
He's a dentist. Okay. That's right. Yep. His name is Dwayne Keller. And he created this tray initially for his mother. She ended up needing periodontal surgery. She was an advanced case. And so, sent her out for surgery. She comes back. He says, "You look great. We're ready for the next one." She said, "Oh, we are not ready. I'm not doing it. You got to find another way because I'm not going to go." This was before lasers, before GBT, before all the easier things. And so she looked at him and she said, "I promise you, I will do whatever you want to try. And we'll come back and we'll see if it works. But you've got to find some other way." And to be clear, not everybody can avoid surgery. You have deep vertical defects. You have granulomatous tissue down there. Doesn't respond to anything topical. Your scaling's not going to touch it. Lasers would be helpful. But sometimes you need surgery. In her case, because she wouldn't do it, he created a variety of delivery methods to get the medication deep below the gums. And originally he was trying to use tetracycline because it was a bacterial-based infection, right? Everybody knows antibiotics are these wonder drugs against bacterial-based infections. But it was the design of the tray that was the first part, and that took a long time to figure out, because if you just use a vacuum form tray, it leaks out and it doesn't get deep enough. And so he figured out how to create this custom seal, and there's some real crafting to that. And then within that sealed system, so there's a seal all the way around the internal peripheral edge and a short extension, and that works like a gasket, prevents the medication from leaking out. He added at the time hydrogen peroxide, a gel, because he wanted what he called a propulsion agent to see. This is back in the experimental days before it even went to FDA, to see how deep they could get it, right? I mean, he was just trying to solve a problem for his mom and his other patients. And he started to get really good results. He got it cleared through the Food and Drug Administration. So now it is a prescription medical device. So it applies to HSAs and FSAs and all the things and he can legally take it to market at the time. So he's talking to a patient one day and he says, "You are doing great. Excellent job at home. Just keep it up." And she said, "Do I need that liquid medication anymore?" And he said, he kind of stopped and he said, the liquid was the antibiotic. "How long haven't you had it?" "Oh, I've been without that for weeks, maybe months." And then he realized it wasn't the antibiotic. It was the hydrogen peroxide that was actually the beneficial therapeutic agent. So then he scraps everything, goes back to the drawing board, goes back to the literature and starts investigating, how can this be? And it turns out hydrogen peroxide, and the primary antimicrobial that we've tested all these years and recommend, is just 1.7% hydrogen peroxide. So it lightens your teeth, but it's not like a wow overnight side bonus. It is. Yeah, it is. But it does two things. It debrides bacteria. And so every time you use this tray, the tray pushes them. The tray is just a delivery device. It pushes medication deep. You peel off another layer of cells, just like if you had an onion and there were layers, you peel it off. But what's really important is as it's bubbling up, if you have brown bottle peroxide, you have a cut on your hand, you pour it, what happens, Reagan?
Yeah, it does. It bubble. It fizzes up.
Light up. Right. Exactly. And it's almost foamy sometimes, depending on how big your cut is. This gel is very different. What's happening when it's bubbling up, it's releasing oxygen because your hydrogen peroxide is turning into oxygen and water. Now, when you have,
Okay.
when you have a cut on your hand and you put a little bit of periogel on it, it doesn't foam. It's a very different formulation. It has a slow, constant release of the oxygen and water instead of that kind of explosive.
Yep.
And what that means clinically is you're getting a consistent release of oxygen. So this matters when you are trying to treat the bacterial-based infections below the gums, because the deeper you get in the pocket, the less oxygen there is. And then you have anaerobic bacteria, specifically gram-negative obligate anaerobes, proliferating. So when this tray can deliver the medication and the oxygen really deep, you change the environment. And that is the way you are really able to get this long-term health and healing. Because when you put oxygen down deep, it's toxic to your gram-negative obligate anaerobes, but it also creates the right condition for healthy bacteria to repopulate. And that's what we want.
No way. Okay. So are antibiotics still used today as part of that decision process? Okay.
Antibiotics are still used today, and they can be helpful. They could be taken systemically, and sometimes they are applied locally, and sometimes they do have a positive effect. The problem is that they wear off, and the bacteria tend to repopulate, and patients, rightly so, they just physically can't clean deep below their gums at home. So we often want to blame patients as professionals, right? They're not doing what they're supposed to do. And most of them aren't flossing. Most of them aren't. And if they are, they don't have great technique. But floss is going to have better plaque control for cariology than it will better biofilm control for gingivitis or periodontitis. Your toothbrush, rinse, and floss can't get deep enough. That is why you need.
Well, yeah, and it wouldn't make sense to just take antibiotics. You've got resistance, can
right.
or allergies.
That's right.
Then if you're, then you're out completely with that. I have an ignorant question for you. I love very much how you are really clinically nerding out. So if you're listening right now as a doctor or clinical, this probably makes a lot of sense to you. To me, this is all very new from the clinical aspect. So And it's all so exciting. So if you are a patient that is maybe in the gingivitis stage, is it something that you continue, like you have this tray and you just continue it like as a preventative for the rest of your life? Or do you use it sporadically when things pop up? How does it, how does that conversation come about with the patients?
Yeah. So ideally, you're going to be using it for life. I personally think it's as important as a toothbrush. I've been using it almost every day for 20 years. Some people stop for a while, the bleeding comes back, they start using their trays again. But the ideal situation is we get you healthy and we keep you healthy, and the disease goes into remission. And let's just look at the stats. 47% of American adults over the age of 30, they're young, have already lost bone. They have chronic periodontitis.
Over 30?
Over the age of 30. By the time we are 65, 70% of U.S. adults have lost bone because of the infections.
So PerioProtect has been around since when?
2005. Yeah.
So to me, this is a travesty. Like, that's ridiculous. That number is ridiculous.
It is. And the reason it can get out of control like this is because this is a disease that doesn't hurt and that we haven't taken so seriously because it's just a little bleeding.
Yeah.
And you might see it when you brush your teeth, but most of the time you're swallowing all of this and you have this chronic infection in your gums, and it's very common, but it's not healthy. And so you asked at the beginning of the show, like, how do we distill this down so patients can understand it, right? Well, let's talk first about how important it is. If you leave these chronic infections untreated in gingivitis or periodontitis stages, it makes it much harder for a type 2 diabetic to manage blood sugar.
That blows my mind. Keep
right.
going. I heard that the other day and I was like, wait a minute, back up. Like, these are discussions I don't think we're having in a clinical setting as much as we should.
Right. And we need you hit it on the head when you open. We need ways to do it quickly and to be able to capture their attention and do it in ways people can understand. But if you have cardiovascular disease in your family or you personally have high blood pressure, this chronic infection in your gum can actually trigger arterial inflammation. It contributes to the progression, not cause yet, but progression of dementia and Alzheimer's. There are some cancers that are associated with. There's just so many things. So if you had even if you had a fingernail that was chronically infected, it would bug you. You would want to do something about that, right?
There have been like these cornerstone moments in my life where a clinician will explain something to me and I clock it. Like, it makes sense. And one I don't remember, so I can't attribute. Maybe Michelle Hudson.
Yeah.
There was a clinician that said, if you have a bleeder, even one, it's not just a bleeder, treat it like an open wound. If you had...
That's exactly right.
Okay. That like clicked in my head, and I realized, because I've heard that, oh, it's just you just got a one bleeder and you just roll over it. Not knocking my own clinical team, but I can see how it can get glossed over so easily and we don't take it seriously.
Right. It's easy to not take it seriously. And I like to throw up these pictures on a big screen of gingivitis and periodontitis and say, what do you all see? And then they'll describe all the things they see clinically. And I'll say, we also see chronic oral wounds. You are practicing, everyone listening in dentistry, you are practicing chronic oral wound care when you treat patients with gingivitis and periodontitis.
As a clinician, are you frustrated with the high-risk patients that are in your practice right now who are not following through with your perio protocol? If so, we can fix this problem together. The Clinical Calibration Institute, powered by PDA, is hosting a free live mastermind featuring Dr. Tanya Dunlap of PerioProtect, September 30th, where she will teach you how to master biofilm control, pinpoint ideal candidates, and learn how to simplify results with the RX tray therapy. Go to clinicalcalibration.com right now to register for this free live mastermind event today.
You are running a chronic oral wound care center out of your operatories.
That sounds disgusting.
It's
a chronic open wound.
It is. It's chronically infected. It's a chronic burden on the immune system. It might be low grade, but look, your immune system is like a battery. There's only so many things that can be hooked up to it before its power fades. So you can do something about these infections in your gums, right? Let's unplug that chronic source of infection and let your body focus on other areas.
This reminds me a lot of the Heart Attack Gene by Dr.
Yes.
Bradley Bale and Amy Doneen. I think that was maybe like 2016 or 2017. My eyes were opened up into what chronic inflammation can do. And then it was still several years before I was able to go through my own health journey and understand my own health from a systemic point of view.
Right.
What are you? I'm very curious. What does the adoption rate look like for those who are putting PerioProtect in the practice, and what sort of objections do you hear? Because it's easy for me, or it's easy for you, especially since you've been in PerioProtect, to say, "Oh yeah, this is a no-brainer. Like this is of course we should have this." What are some of the things that you've heard that make people say, I don't know, they don't need it, or like you had me there with the slow release, because I have heard, and I don't remember where, but I have heard like if you just take some hydrogen peroxide and put one of those little Christmas tree looking flossy things and just go between your teeth. Yeah, I've heard that. So like, does that like that wouldn't be the same because that's an instant release versus a slow release. So
That's right.
Maybe be my eyes and ears. What have you heard over your years with PerioProtect and some of the objections?
Right. Well, for some patients, exactly say, why can't I just use a rinse? Why can't I just rinse? Why can't I put hydrogen peroxide in my water flosser or put some gel on there, interproximal brush and brush? So the number one problem with a rinse is that it just doesn't get deep enough. Your interproximal flosser would get deeper than a rinse, but it still needs contact time. So this is the part about hydrogen peroxide. It has to be held in place long enough to be effective. And I can't speak about other formulations, but the gel that we have tested in the perio tray needs 10 minutes of contact time in order to, so we're going to hear it out a little bit. Your bacteria live in a living film, the biofilm, and could be hundreds of different species in there. And they're all communicating, and what one bacterial species is producing as a byproduct, another one uses as a food source. It's totally fascinating and complicated. It's covered in a layer of slime. They call that a matrix. You need time to be able to cut through the matrix. And antibiotics can't do it well. This is why when you place an antibiotic, you do it when you do scaling, because an antibiotic can't cut through that layer of slime well. Chlorine-based products and peroxide-based products can, but it takes a little time. We need 10 minutes to be able to cut through the matrix, the slime, and then penetrate the bacterial cell walls and you're just doing the exposed surface layer. We want you to wear the tray for 15 minutes because then you get almost all the oxygen benefits. You can go longer, it doesn't help you, but you need at least 10 minutes. So most people are like, am I going to have to do this for the rest of my life? And I say, that's another objection. I say, you get to. This is a way.
It's not that long.
So you tie it to something you do. Have you ever read Atomic Habits?
Oh, yes. I love Atomic Habits. Oh, habit stacking. Let's habit stack this.
That's right. You're going to stack your habits. Exactly right. So I tend to wear my trays in the morning when I'm getting ready. Some people are really ritualistic about that. Every shower, before you shave and shower if you're a guy. I have a new puppy. I've been wearing my trays while I'm walking this dog. There's all these different things you can do to stack the habits and make sure you do it. And the thing about PerioProtect is that there is a level of clean you didn't know you could get to. And if you use this for a while and your mouth feels, this is what patients say, they'll say, my mouth just feels so clean and my breath is so fresh, which is all true. I personally think the fresh breath is nicer than whiter teeth because, with this, you don't even wake up with morning breath. Those of you who are part of the profession and you take great care of your mouths, I know you do. You won't even wake up with morning breath. But
from a patient perspective, if somebody told me, do this 15 minutes and you're going to wake up without morning breath, that's the best marketing campaign I can think of.
You can eat. Yeah, we say you can get closer to the ones you love because sometimes you can smell people before you can see them, right? Like
right? I'm not known. Like I didn't know before joining dentistry what it was, but I've been around, and you can almost smell them coming towards you, and then you have to be around it, and it's painful and it's uncomfortable.
It's uncomfortable for everybody. Like if you're on an airplane and you know what that is, I have to stop myself from talking about it on an airplane because I know there's a really good solution. So I think for patients, when they find out how comfortable it is, how easy it is to use, the side effects, you can drink as much red wine and coffee as you like, and you are going to have really white teeth. You just do it 10 to 15 minutes a day. But the rinse doesn't get deep enough. And I think from the professional side, what most people are concerned about is if we put patients in PerioProtect and then they need restorative work down the line, what happens? Or if a patient has really serious perio but also has restorative needs, what do we do first? And so we just talk through those different scenarios with people to help them
you want
understand.
it not to be bleeding first, I would assume.
Yes. And, sometimes you end up with really complicated situations, but best case scenario, you get the perio foundation, but you also want to address those restorations too. And people have limited money. So how do you figure that part out? And so we often work as like an office consultant. We've been doing this for a long time. We have treatment protocols. We have experts you can talk to, periodontists too, that will also weigh in. And so we do as much as we can to be helpful.
Is this a product that is direct to consumer or only through dental practices?
It's only through the dental practice. So that trade is cleared by FDA as a prescription medical device. So it does require that comes through the dental office. And then they get it because it's made specifically for them. And some docs will
consumers could be educated and drive this, because I think if consumers really knew, preventative health, is it's not just a hot, trendy topic. It's such a critical topic right now. And healthcare in America is just, feels like it's on fire in so many ways. And there was one thing I don't want to gloss over here that you said that was highly intriguing to me. And that's that it gets in and gets the bad stuff, but it does not, not only does it not harm the good, but it allows an environment for the good bacteria to thrive. And I know with antibiotic, imagine, I don't know if you're working on this, but what if we were able to do this at a gut level?
Right. Yes. The gut is totally the next frontier. Everybody's looking at it, right? Leaky gut.
I hope everybody's looking at it, because creepy just sits in your gut, right?
Right. Yeah.
Wow. So you do, so it does truly allow the good bacteria to thrive.
It does, because you are adding this oxygen. It's all about the environmental conditions. So you change the environment, you change the kind of bacteria that can thrive. And look, we're never going to be able to get rid of all the bacteria. We don't want to. You want a healthy microbial community that lives in a symbiotic relationship with the host. That's what we're after.
What are the doctors? I'm going to give you a second to think about this. I don't want to put you on the spot, but the doctors that you've seen that have implemented this in practice, is there anyone that's particularly memorable or you think is doing a really good job with this, explaining the benefits?
I am. And I do want to get back to like the easy way to explain it to patients, but there are 2 or 3 that come really front to mind. Michelle Huckey's in Jacksonville, Florida.
Yeah.
Her office is so in tune to PerioProtect and the benefits, and the patients talk to each other in the waiting room and say, you don't have that yet? You should totally get it. This is why. And come back and ask for it, right? That's exciting. We have another doc in Chicago, a team, Dr. Joseph and Eileen Netzel. They're a terrific team, and their patients, they're truly honing in on root cause, right? And making sure people understand this and really going above and beyond. So there are other drugs you can put in these trays. So the hydrogen peroxide is what everybody knows. It's branded as Periogel, and it's 1.7% hydrogen peroxide, low concentration, all the things we've talked about. But there are other drugs you can put in there, and they've documented bone stabilization, and they're now beta testing some medication that we are offering for patients. They haven't been PerioProtect patients before, but they have such serious sensitivity that it's miserable to come. So we've got this new option that is going to be released here soon that people can use to desensitize, and it's getting great patient reviews. So one of the best parts of my job, Reagan, is getting to know these clinicians who care deeply about their patients and their teams. They want good culture in their office too, but really care deeply about their patients. And they're doing this for the right reason, because they want to end those chronic cycles of infection and inflammation. And as you mentioned, it is hard to talk to patients about that, right?
Yeah.
So it's taken me a while to do this. I have been doing I'll call it market research, but really focus groups since 2018. And I have been talking to people saying, how much bleeding is it okay to have in your mouth? Like how many, because you chart this, right? As a dental professional, you chart how deep their pockets are, whether they're bleeding, clinical attachment loss, as often as you do that. Okay, so let's say your patient has 168 possible bleeding points, right? You don't have wisdom teeth. You have 168, six per tooth. How many is it okay to have? Is it okay to have 30? Is it okay to have 16? Is it okay to have 5? A lot of people want to say 0. And I say, yes, that's ideal.
Yeah.
But I don't think you're going to get every person to 0. We should try for it. We should.
Yeah.
0 would be the ideal. But what's healthy? No one knows.
Well,
We don't know. How can we know?
No, I think that the goal is to keep the inflammation as low as possible. So
That's right.
And we know, I mean, I love how I say we know. I've been told and educated that hormones can change it. So if you have hormone fluctuations,
That's right.
that can change it. I mean, personally, I know I've had a visit where I had bleeders and I was like devastated. And then the next time I had none. And it was, the hormones changing can play a factor to it. So I wonder if perhaps since nobody maybe has the term for what the right answer is, I think the right answer is 0, but maybe it's a pattern over time. So making sure that people are getting in for their annual.
That's right.
Don't even get me started on who came up with 6 months and why they came up with 6 months. I mean, if I could see mine every month, I probably would, but that's because I'm a weirdo. So my hygienist has an Air Max Profi or whatever.
That's right.
You don't even know what they have. Oh, she's amazing. Yeah. So I know I'm an oddball there, but I just am so pleased that you and PerioProtect, but Kim Cooch and all of the others in our world right now that are focusing on the systemic level of care and preventative health is just, I can't say enough how much it means to our world and our future generations. So if we also set the expectation that 0 is where you want to be at, that starts to you can reinforce that over time.
And you need to be able to do that quickly because it is hard to get people's attention. So what we ended up doing, and I want to be clear here, I don't want to be dismissive. The AAP has set up 10% or less of your sites are considered healthy, right? You want a 0, like there's a standard, there's a professional standard.
Yeah.
But when you talk to patients, you're like, well, what do you think? 16, 17 sites? Is that healthy? And they're like, So in focus groups, we've come down to 10 points. Bleeding points. You can do 10% if you want, but 10 points, 10 or less, we consider healthy, and 0 is ideal. And so we did this whole campaign, like, what's your number? We even had scrub caps that say, what's your number? And I was like, I'm giving these to people. It's not a pickup line. We want them to ask a question like, what's your number?
So the number is not your pocket depth.
No.
I have heard, what's your gum score? And I was like, well, that's got to be your pocket depth.
What's your gum score is how many bleeding points you have. Because how do you know if you're healthy? It doesn't, it doesn't hurt.
Yeah.
Nothing's, your teeth aren't mobile yet. You can mask your bad breath. And you might see some blood when you floss, especially, or brush, but you're like, it's not doing that all the time, right? So here's how we did it. We created a gum score with a number. And the number is the number of bleeding points. And we use that just like you did for blood pressure. Like, how do you know if your blood pressure is in a normal range?
You've got your number, your top and your bottom.
That's right.
And then you look at the colored chart that say, you go, on the wall. Am I in range or out of range?
That's right. Or your cholesterol or blood sugar or whatever it is, right? So
that'd be great to have that as a little poster on the wall too, like a little color coded. What's your gum score? Just like your blood pressure. You could even.
That's right.
If you don't do that, you should do that because that would be mimicking, right?
So we have this whole campaign rolling out. And you don't even know that, but yes, you do.
No, listeners, I came into this blind like I come into most of my interviews intentionally so that I can be just as curious and maybe ignorant as you are with a little bit less clinical knowledge. But no, I didn't know that. But that would be, I can't wait. I can't wait to see this campaign roll out.
Well, I will give you the less than a minute 5-point presentation for a patient. So you come in, let's say you have 48 bleeding points, Reagan, when you come. So we do the whole thing. And then as your hygienist or your professional, I would say, I'm concerned that you have a high gum score. It's 48. That means there's 48 areas in your gums that are infected and bleeding. Now, the ideal score would be 0, but we want to get you under 10. So we're trying to move from 48 under to 10 as close to 0 as we can. The third point is so important. I know you're trying hard at home.
Yeah.
The problem is that your toothbrush, rinse, and floss just doesn't get deep enough. And that's why we prescribe PerioProtect. This is a special tray that's made just for you that will gently deliver the medication deep so that the medication can fight that infection. You just wear it 10 to 15 minutes a day. Not only are you going to have healthier gums, you're also going to have whiter teeth and super fresh breath. and then stop talking because you told them a lot, right?
Yeah.
Kids, let you go along with it, all of it. Yeah, right. Let it sink in because then they'll come up with questions. And if some people say, I need to think about it, there's 2 routes you can go because this is no sales pitch, no pressure. We're not trying to like sell anybody anything. We just give them the information that we think is the best care and they get to choose it. So if they say, I need to think about this, I would say, I'm really glad you are going to continue thinking about this. It's important because this is not healthy. What can you do differently now at home to improve your health? So what can they do differently? It's up to them. And I silently, awkwardly wait for them to answer, right?
It can be painful, but it's important to let the brain process what it's heard. And you get nervous, we fill the space, but when you say such an important anchor statement and you deliver it with that care of this is really important. It's painful for you, but it really does a service for the patient to allow that silence to sit for a little bit.
And then you also get some judge by what they say as to what is their dental acumen, because they might say, I'm going to floss every day, or I'm going to brush twice, or whatever. And you say, terrific, that is a good first step. We're going to document that, and we'll score your gums when you're in next time. In the meantime, you hand them a brochure, and you say,
floss.
Well, even if they do, it's not going to matter. It's not going to get deep enough, right?
That piece said that to your 4-step process there, I was going to say, do you know how amazing it's going to feel to be like, you could even say, this isn't your fault. Like you could brush and floss several times a day and you're still not going to get deep enough. That like takes that pressure off that person. And
that's the idea, because people who are defensive, like they can't hear you, they're closed off. They can't understand what you're saying. And you are like right there with them because you want better results for them. Yeah. And it's not your fault. They want better results. And honestly, it's not all their fault. Sometimes it's not their fault at all. And so to be able to say that, and then what are you going to do differently? That's good. Let's start there, and we'll score your gums next time. Take this brochure. Let me know if you have any questions before your next appointment. And you just go 2 different routes. My main concern for you is the infections around your crowns. We've been monitoring those. We want your crowns to last as long as possible, and they will with healthy tissue. Or my main concern is that this chronic infection in your gums is going to make it harder for you to manage your blood sugar as a type 2 diabetic. And you just stop talking because it's totally up to them. They get to decide what they do and don't do, but they can't make a decision if they don't know.
No, and it's not fair for them not to know. I think that's Heather. And for me, the travesty, like I said before, if they don't have this as an option, then and they're stuck to just brushing and flossing, and we know that that's not going to do what it needs to do. That's unfortunate. And it's not that this is the only solution. There are other solutions, but
there are.
To me, if I have an opportunity to prevent surgery, perhaps, and be in that preventative
or to prevent bone loss in the early stages, or to prevent the infection around the implants that you just put in, right? All of these things are good reasons.
Oh, that is some of my favorite discussions of all is how are you going to take care of this investment that you have just put in your mouth? Those crowns there are some dentistry, which we know is a serious investment. So it is.
That's right.
You want to keep the tissue around it really healthy, but you have to have those conversations.
Yeah. Right. And we hope if anyone tries out the gum score, that it will get your patient's attention so that they accept treatment that they need, whether it's PerioProtect or not. It doesn't matter. Yeah. I mean, I want that, but you know what I mean? It's important that patients understand that chronic infection needs attention.
Tanya, your passion for this is incredible. And I am really thrilled to announce, I did not forget, but I held it off, listeners. You are going to be presenting for free, so anyone can attend. That's right. This coming September 30th. So Clinical Calibration Institute is hosting a mastermind session with you to dive deeper into this topic. I just came up with that on the fly. I'm just so clever. We're going to dive deeper into this topic, and it's really going to be a product agnostic mastermind session. So you get CE for it. It's AGD compliant, and I can't believe that I'm really excited that you're going to do this, and I know that you're going to do this because of your passion and all of the education that you have. So this will be September 30th, open to everyone. I think it's 1 p.m. EST. So if you listeners, if you want to hear Tanya go deeper into this, go to clinicalcalibration.com and you will see an area to sign up for it. Is there anything that you want people to know about this particular mastermind session?
So bring your questions. We will have images, so you'll get to see case studies as we go through. We can talk about as much research as I used to be the research liaison. So I love talking about that data. I spent 4 years of my life on it. So bring your questions, we'll talk
light up.
And it'll be a moment for you to really explore the options for your patients, for your practice, and decide if this is something you want to try out. There's no cost, right? So it's an easy entry.
Wow. Well, thank you so much. If people want to get in touch with you in the meantime, because I know you're going to go register clinicalcalibration.com, but other than that, how can people get a hold of you?
So the easiest way is support at perio-protect.com. But if you get my actual name and number, it's T Dunlap. So T for Tanya, Dunlap, LAP at perio-protect. That's a really easy way to get a hold of me.
Thank you, Tanya, so much for sharing your passion. Thank you, Reagan, and helping improve all the patients.
Thank you very much for your interest and for this time. I've really enjoyed it.
Thank you for listening to another episode of Everyday Practices Podcast. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.